Hey, Margie here. Wouldn't it be nice if there was a belt that you could wear for 30 minutes a day that could improve your bone health? Well, guess what? There is such a product, and it's called OsteoBoost. And it's a vibration belt that's based on the research of low intensity vibration in our bones. It's created by a company called Bone Health Technologies. And today we're going to delve into this product, OsteoBoost, with the CEO of Bone Health Technologies, Laura Yecies. And Laura's goal has always been to be involved with innovations to improve health outcomes. She's a serial entrepreneur, formerly CEO at SyncThink, Catch, which was acquired by Apple, and SugarSync, and has led multiple successful brands at Checkpoint, Netscape, and Yahoo. Laura received her MBA from Harvard, has a Master's of Science in Financial Services from Georgetown, and her Bachelor of Arts in Government from Dartmouth. But today we're focusing on this new device, OsteoBoost, the research, who it's intended for, and how it could really be a wonderful tool for people with osteopenia and osteoporosis. So stay tuned and learn all about this new device. Welcome, Laura. I'm really excited to have you here because this is different. Usually there's an existing product that we know about that I have the guests come on and talk about. But this is a new technology, something that after reading the research, I just can't get over. It sounds almost too good to be true. So I'm really thrilled to have you here sharing. So we'll be the first. Everybody listening, you're going to be one of the first people to hear about this. And I'm really excited because this is what we're looking for. New inventions and things that can help us that have just so many positives. So before we get started, I always like to hear the backstory. So why don't you tell us, because you didn't start anything to do with bones, with your background, how did you get into being involved with this product?
Yeah, thanks. Thanks for having me. And I just want to let you know, I share your enthusiasm. I'm so excited to be involved with the company and working on this product. The backstory is I grew up in a family of doctors in New York, and I was sort of the black sheep of the family, didn't want to go into medicine, went into business and technology. After business school, I came to Silicon Valley and worked for about 25 years in software and really loved doing that. I led the Netscape browser division, Yahoo Mail, was CEO of 2 companies, and sold one company called Catch to Apple. The Catch team ended up essentially being the Apple Watch team, which obviously has a big health footprint. But at that time, I had a chance to sort of reassess what I wanted to do and thought about actually going into more of a clinical world, going back to sort of my roots. There were a couple of things that had happened in my life that got me more interested in healthcare. But at the same time, I saw this convergence of technology and health. And frankly, I was so, I really found it empowering and exhilarating when I would work on something in technology and it could be distributed to millions of people. So if we improve the Netscape browser, 60 million people would get it within a week. Same thing with Yahoo Mail. And so I was like, how can I have this kind of scalable impact on people's health kind of in a technology style? And so that whole convergence was happening. I started working in the field, doing some consulting. I was then got my first health tech CEO role in a diagnostic company that was using eye tracking in VR to diagnose concussions. And diagnosis is important and very interesting, but you can have an even bigger impact with a therapeutic. And so over the last year, I started looking at different therapeutics that were having an impact and was invited to join the board of Bone Health Technology. And after a couple months of my board service, and I started to see the science behind what we were doing and the data behind what we were doing, and the fact that we are addressing a problem that affects literally, 50 million Americans, half of all women will have a fracture due to low bone density, 1 in 4 men. This is a widespread problem, and it's a serious problem. a side note, when I was in college, my dad worked at a nursing home. And so I had a summer job as a nurse's aide working in this nursing home. And so I knew just in my gut and from that experience how serious and significant it is when someone has a fracture. Half the people in that nursing home probably, or maybe more, were there because of hip fractures and inability to be independent. So as soon as I saw a company that had a real shot at making a difference in this problem, I was really excited to get involved, and no regrets. It's been really, really exciting so far.
So let's dig in, because everyone is sitting there. Let me hear about this great discovery. So why don't you tell us about OsteoBoost and the product? And I know that you're wearing it, so you can show it to us as well for anyone who's watching it as well.
So first I'll show it to you. So what you see is it's a belt, and you can wear it comfortably. It weighs just a couple of pounds. But the more exciting part is not what it looks like, it's what it does. And what it does is using clinically proven levels of and types of vibration, it applies vibration to the skeleton. In particular, you wear the belt at the lower part of the back, and it's sitting essentially at the sacrum. So you're applying this vibration directly to the hips and the lower part of the spine. And there is a large body of research that was originally done at NASA by a scientist called Clint Rubin. And that body of research showed that precise types of mechanical stimulation, mechanical vibration, would stimulate the bones. And so we saw this learning, this data, and thought, okay, how can we take that knowledge but create a product that was really easy, convenient, and actually comfortable to use? And the physicians and engineers and developers behind OsteoBoost looked at a bunch of different form factors, a lot of tweaking, and came up with the product that I just showed you. And the exciting thing is that we're actually seeing very, very good signs of efficacy. So we did a proof of concept study with the belt and showed that it significantly reduced biomarkers of bone turnover, so that we were showing that there was a very quick response biochemically in the body, that you were breaking down fewer bone cells. And based on that data, which was statistically significant, we applied for and received a grant from the NIH for over $2 million. And with that grant, we're conducting a pivotal study where we are studying the effect of, it's sham controlled, the effect of this belt in a large number of women. This is being done at the University of Nebraska. And we're based on this, we're hoping to apply for FDA clearance for a prescribed product. The study looks at DEXA scan results, which is sort of the common way that bone density is measured, some other novel ways of measuring bone density, but this will give us very clear proof of the efficacy of the product.
Can you share, because the graphs that I saw were really incredible about the percent of improvement that they showed in both the hip and the spine with the DEXA, which is really, was very, I was quite impressed when I was looking at the research.
Yeah, so we don't have finalized results yet for DEXA scan, but what we do know for sure is that we're seeing efficacy both in NTX and other markers on par with medication. So that's our goal, and we're very optimistic of meeting that.
So that's great. I mean, just think of that, that someone can get the same results from wearing a device for 30 minutes. Is that right? Is that your recommendation, 30 minutes?
Yeah, so, and let's talk about why that is. Okay, so your bones are constantly remodeling, constantly turning over. Your bones are alive. And when they're turning over, they're looking for signals from the environment. And one of the things that we know is that high impact exercise is one of the best ways to stimulate your bones to improve their density and for the resorption to go down and the bone creation to go up. And it's essentially stress being applied to the bones that is signaling to them time to renew yourself, time to improve your bone density. But the problem is it's very hard for many people to do high impact exercise. And there was research done at the cellular level, it was done in animals, it was done with whole body vibration that proved very conclusively that vibration is essentially giving the same signal to the bones. It's almost like it's mimicking high impact exercise and leveraging a natural process to improve your bone density. And we believe do it where you'll have even higher quality bone than what you end up with the improvements you get from medication.
Well, it's so interesting because I know in the research, they showed how the bone has an option. These mesenchymal stem cells, they can either turn into fat or they can turn into bone. And with the vibration, they're turning into bone. So that's just so huge. And it's really something exciting because this isn't, I look at it as in addition to doing, it's not as though you do nothing and just do this, but probably if you did nothing and just did this, it would still be helpful. But think about doing this plus all the other good things that people are doing in terms of their exercise and their
whatever exercise they can do. Resistance training is shown to be very helpful for bone density. Of course, diet, you need adequate calcium and vitamin D, not smoking, limiting alcohol. But for many people who are doing all those things, the missing link was the high impact that maybe they couldn't do. And so, we think that this will play a key role.
Yeah, I think it sounds, to me, when I read the research, I was just, wow, isn't this wonderful? Because another way to stimulate bone that's natural, there just isn't really anything negative about it. It seems as though it's something just such a win-win.
In fact, one of the things that we're learning in the clinical trial is people actually enjoy wearing it. It feels like a mini massage. It's able to, be incorporated into their daily lives. So you can wear it while you're walking the dog or while you're doing laundry or cooking. The only real restriction is that you can't be sitting down. You need to be in an upright position. But because it's so flexible in terms of how people can incorporate it in their daily life, we find that they use it very consistently. And, as you know, for things to work, you have to use them consistently. It applies to nutrition, it applies to exercise, and it applies to our device as well.
And so is it daily in terms of consistency?
So what we're studying in our trial is 30 minutes, 5 times a week. So almost daily.
You get, if you're going away for the weekend or something, but you can carry it with you. That's what's also nice. It's not, yeah, I can't wait to get one to, I'll certainly make a video when I get one and see how it feels, but it really looks amazing and just so portable.
Cool.
Yeah.
Yeah, no, we're excited. One of the things that that got me really interested and excited about this is just frankly that osteopenia is a common problem. And, it can be a misperception that because something is common, it's not serious or it's not a risk to health. I think of it almost like high blood pressure. The more we know now, the more that we are intervening and trying to improve people's blood pressure and keep it at a lower number. We have safe, proven treatments. And so as we have safe, proven treatments for bone density and something like OsteoBoost, the number of people that we can address and help improve their bone density is really large. And our initial clinical trial is for osteopenia. And right now, there's really not approved therapeutics by the FDA. The drugs are typically used once you get to osteoporosis. And so today, if someone take an example of a postmenopausal woman, she goes to the doctor, she has risk factors, she gets tested, she has osteopenia. And then the doctor will potentially be saying to her, oh, you already exercise, you eat well. Okay, well, do the same thing and wait for the other shoe to drop. Essentially, just wait to decline. And that's a terrible situation. These women want something that they can do. They want to intervene. They want to improve their bone health. They've seen their grandmothers shrink and hunch over and get hip fractures and get, compression fractures in their spine. And so, I'm excited about the idea that earlier on in a more preventative way, there's something that we can do.
Yeah, I think this is incredible because that's sort of my philosophy too. I believe that every single person should be, just like people are screened for their heart and other things, people just aren't for osteoporosis. Even pediatricians, I believe, that if a kid is sedentary or they're not having the right diet, you make sure they're doing things so that they're building bone. But you're
Yes.
absolutely right. People get osteopenia, and maybe they say, oh, don't worry about it, it's just osteopenia, or, but it's an indication that maybe you never built as much bone, or you're starting to lose bone, whatever it is, that you want to take action. And what's nice about this is an easy way with everything. I also look at it as, when you get the diagnosis, it's a wake-up call. It's a wake-up to look
Yes.
at your habits and look at everything, but also how wonderful to have another tool
Yeah.
that's easy to use that can make a difference. And so, yeah, I think
I
that's
love how
fabulous.
you gave the analogy to cardiac health. I think that is a very good way to think about it, where we now have the mindset that, we manage and try to prevent heart disease very proactively. We're checking blood pressure regularly, we check cholesterol levels regularly, and we intervene, and we have guidelines, and we do heart attack risk assessments, and that guides that intervention. Well, fractures from osteoporosis or osteopenia can be, as life-altering as a heart attack. And so I like the idea of thinking about them in this analogous way, and treating them similarly seriously, because they are so important. The other thing I want to say is that there's actually more fractures from osteopenia in the US than osteoporosis, just because even though the risk level per person isn't high, there's so many people with osteopenia, men included, by the way. This is not a disease only of women. That the largest number of fractures are in people with osteopenia. So it's something to really be actively working on.
It's such a good point, because the DEXA only tells you one thing. It doesn't tell you the quality of the bone. It's more the quantity of the bone. And so you can have osteopenia, but your bone quality is not good. You're going to be more apt to fracture. So that's really a good point that you brought out in terms of also
Yeah.
fracturing. Yeah. So
Yeah.
I'm thinking, yeah.
One of the tests that we're using in our clinical trial actually is interesting. It's an FDA approved test called Virtuost that actually uses CT to look at bone strength. So we will be actively in our trial looking at not just improvement in bone density, which of course is important, but bone strength.
Oh, that's great. Yeah, the other thing that's so interesting, I'm thinking in my head that, there's so many people at a young age who are at high risk, people who've had anorexia, eating disorders. There's so many populations who I see down the road, but yet early on, if you had told them, oh, besides doing these different things, also you can wear this belt, how easy is it? That's really great.
Mm-hmm. Yeah, no, we're excited about that. And over time, we want to expand this into, an earlier stage where it can be used preventatively. But you're right. There's many things that lead to osteopenia at a younger age, or, being on steroids, poor nutrition, even whatchamacallit, gluten issues where people don't digest as well. So yeah, it's a variety of factors.
Yeah, and that's on this podcast. We've had so many different guests with so many different root causes of osteoporosis. So I think the listeners are, so accustomed to that there's so many things that influence your bone, but where this is so nice, because we're all looking for natural things that we can do. And this is just what I like, easy tweaks, but this is really an easy tweak. And I think it's very exciting also that you're getting approval. So can you explain that, where that stage is at for?
Yeah, so what we're doing is we are going through what's called a pivotal trial. So we have submitted our clinical trial plans to the FDA. We've gotten agreement with them on what those endpoints are. I mentioned DEXA and Virtuost, which is bone strength. And so we are now doing a sham controlled clinical trial. So there'll be two groups, one with the active, one with the sham treatment, and we will compare their pre and post bone density. We're doing this in partnership with University of Nebraska. And based on our results there, if we meet our endpoints, and we're very optimistic about our ability to do so, we will apply for FDA clearance. And we actually, one thing that's very exciting is we received a breakthrough device designation from the FDA back in December. So the FDA, you can apply for this, selects certain devices that they view as being so important because they're meeting an unmet need from a healthcare point of view, an important unmet need, and have a good chance of solving it, and that there aren't essentially alternative solutions. So there's a real gap in the market. So the FDA granted us this designation. So they're recognizing how important the problem is. NIH granted us over $2 million to do this study. So they also are recognizing that this is an important problem. So hopefully we'll be able to move quickly after the study into an FDA approved device. So essentially your doctor would be able to write a prescription for this device, and the indications for use of the device would be for the treatment of osteopenia. And there would be some more specifics about exactly what measurement of osteopenia, but basically to treat osteopenia. And the advantage of going through this process is that we then qualify for reimbursement from Medicare and hopefully private insurers. And also the population, doctors and patients will know that our clinical claims have been reviewed by the FDA. So we want to subject ourselves to that rigorous review.
That's great. And so then someone with osteoporosis could still get it. May not be covered by insurance until you have the studies to show it also helps.
Yeah, so we plan as a follow-on to study in osteoporosis, to study in combination with medication. We'll probably do different dosing trials, but this is sort of our starting point. And we focused and chose osteopenia because there really aren't approved treatments. Most of the treatments are for osteoporosis.
So interesting. Wow. Yeah. No, when it was sent to me, I'm reviewing it and I'm thinking, wow, this is just such a win-win situation. And the preliminary data is excellent in terms of the hip and the spine bone density. So yeah, it's really great. And so what other things do you want to share about? Because this is just exciting. You must feel so excited about this.
Maybe let's talk about who has osteopenia right now. So, what we know is that during, right after menopause, women tend to lose a lot of bone. In fact, you can lose up to 20% of your bone density in the 10 years after menopause. So there's this time period of accelerated bone loss, and it's hard to get that back. So we think that there is an important sort of window of opportunity. Of course, it's never too late. It's better to slow the decline or try to improve your bone density later. But we think that there's an important window of opportunity in this postmenopausal period to really get more active about managing and trying to halt this accelerated loss of bone density. So the changes, the hormonal changes, unfortunately lead to a higher rate of bone turnover. And when you have that higher rate, there's a risk of it kind of going in that negative direction, and it frequently does. The other thing I would say is it's more a matter of not if, but when. So, even people who had very high peak bone density and relatively normal rates of bone loss will likely end up having osteopenia in their 80s. And then or 70s, if you peaked at a younger age or had a lower peak bone density or a higher rate of loss or some of these other conditions that you talked about, it'll happen earlier. So this is something really for most of us to have in mind. In fact, it's I think very analogous, like we were talking about earlier, with high blood pressure. The older you get, your veins and arteries stiffen, you're likely to have it, and you'll benefit from treatment. I think the other thing to talk about is really fracture risk. So, bone mineral density is important, but it's really a data that's a means to an end. What we're really concerned with is avoiding fracture. And so, we're focused on helping people improve their bone density with our device, but there's a whole broad set of activities that they can be doing beyond bone density to try to minimize risk of fracture. And any other things that are going on in your life that raise your risk of fracture, then it puts really a premium on your bone density to be as strong as possible.
Oh, I so believe that. And what I've seen in my practice, and I've been working with people with osteoporosis for over 25 years, is that, yes, I agree with you. Early on, anything that can be done in all those realms that are going to put stress on your bones, whether it's psychological stress, whether there's an underlying root cause with your nutrition. A lot of people just need to also up their exercise, but you can do both. So you can do this plus be also giving a little boost to your bones. That's easy to do. So to me, it just seems to go with everything else. It seems to be like this amazing, amazing tool that we can add to prevent something that we really don't want. I mean, nobody wants fractures and nobody wants, to continue to lose bone. So if there's something that we can do that's saying to ourselves, hey, you're turning into bone and not fat, it's incredible.
The other thing I think it's worth talking about, and something that I think is so important, is just knowledge. Knowledge is power, and knowledge of your bone density. So, Medicare pays for a DEXA scan for everyone when they turn 65. But DEXA scans are not very expensive. I mean, they should cost under $100, even if you have to self-pay. And the amount of radiation in them is minimal. So, we should be asking our clinicians to check our bone density much earlier. People will oftentimes be surprised. The surprise can go both ways. But wouldn't you want to, if let's say you have pretty advanced osteoporosis at 65, wouldn't you rather have known that at 52 or 53, right after menopause? And you would have had all of those years to intervene. Also, to know how you're doing. So just like, you got your cholesterol level, and you make some changes, you lose weight or you change your diet, you can go back and see if it's working. And so I think this is something that's really important, just to be able to have that information and knowledge. And the other thing I would say is that, there's some, other tests, like I mentioned the NTX, where you can see the impact, quite quickly on interventions. This is both a blood test. It can also be tested via in urine. So, there's a lot of available information about how we're doing with our bone health. And I really encourage people to avail themselves of that.
I couldn't agree with you more, because just like you said, 65, you've lost so much time. And a lot of people, the thing with osteoporosis that's so different, and I think so frustrating also, is that you don't know. And it's even frustrating as a physical therapist, because it's not as though, or as a health coach especially, you work with someone and they have back pain and they get better, or they have digestive issues and they get better. But you don't know until you do these testing, exactly what's going on in the bone. So I think you're right. I think early testing is very important. You certainly don't want to wait till you're 65 and then find out, oh, I have osteoporosis, and as well as the NTX, and as well as these bone marker tests, because they can give you good information. Are you actively losing bone right now? Or is it something that as a child you didn't build bone? So there's such a huge difference. So I couldn't agree with you more in terms of getting early testing. And then it also it gives you an indication where you're at. So and then you can check with your habits, with
how you're having an effect. So we have the DEXA scan, we have NTX. The other thing that is widely available, it's free, your listeners can do it today, is the fracture risk calculator. And there's a couple of different calculators that are available. So one is called FRAX, F-R-A-X. And that is, used by a number of governments to assess fracture risk. And so it's well validated. On the American Bone Health website, they have another risk calculator that's very easy to use. So even if you don't have immediate access to one of these tests, I encourage people to use the risk calculators.
And that's good. And a lot of doctors will use that. That's, commonly everybody knows about the FRAX, and that's good information. But I think, yes, just get it. I think that's been the problem. People think of it as an older person's disease. I have other things to worry about. I'm not going to worry about my bones. And there's so much we can do. And if we start as young as possible, we can actually make a huge difference and hopefully put this off the map.
And I mean, it is an older person's disease in the sense that that's when it catches up with you, but it's what you do earlier on that is going to set you up for what your bone health is like later. And so really, when you're younger is the time to try to avert some of those more difficult to treat situations.
Oh, I couldn't agree more because, our peak bone is at age 30. So all those years are critical. We're putting money in the bank, we're putting money in our bone bank.
My
And
poor
so,
daughter is 28 and I like practically harass her about calcium. Like, you only have a few more years left to build bone.
Yeah, it's really true. It has to, it's one of the projects I'm working on. I work with the state of New Jersey, and something that we're working on is really to be educating the young people what they can do to help with their habits. And because it makes a big difference, what you do when you're young can completely change the trajectory when you're older. So it's not an older person's disease. It's really a pediatric, but manifesting it just like you said. So yeah, so this is just so exciting. And because I just wanted to bring this information to everyone to know what things are happening. Sometimes it's nice just to know, number one, for hope. I think but I always like to introduce new things. And this is an unusual one because normally I test everything, but reading the research, I really thought that this was based on research that I believe in. I'm a big person who believes in the vibration and in the
Yes.
research from NASA. So so this
Yeah,
is
no,
just,
we're big believers in that. And it was really the starting point or foundational science is, I guess, the best way to think about it for our company. But just essentially going from that into how can we do something that's more accessible, very convenient, easy, and that sort of directly applies the vibration to the hip and spine. As hip fractures and spine fractures are really the places where osteoporosis can impact morbidity and mortality.
yeah, no, it's all good. I'm such a believer in anything that we can do that helps us. And this is brilliant. I think it's, I think it's really so smart, and I'm very excited. So
Yeah, we can't wait to get you the device once
yes,
we're.
and I will make you a little video of me and the device. I believe, because I really believe, I always try things myself before I
Mhm.
talk about them to other people. But this research was so good, and I just really think that this product can have a huge impact. And I'm excited the idea that it's a possibility even to be covered by insurance. That's
Yeah,
incredible.
no, we're very optimistic about that. And we're trying to make sure our pricing is such that it works economically. And osteoporosis is an expensive condition. So we're spending 19 billion a year dealing with fractures. So a small investment in prevention is
Do you
obviously.
know yet the price, or you haven't really
I mean,
established
I
it
think
yet?
it'll be under $1,000, probably in about the $800 ballpark. We're still doing, a little bit of research, and obviously we'll be discussing it with the insurers. But
Which
that's the
certainly
ballpark.
compared to medication and other things is not in the realm of things. That's really quite low of a price to pay for.
Yeah, our goal is to get this in the hands of a lot of people, um, and just balancing that in the business. And that's sort of our thought process.
Yeah, sounds great. So everyone is sitting here like, when is it going to come out? How do I get in touch? So I know that you gave me a link that I can
Yeah.
give people.
So if you'd like to learn more, you can go to bonehealthtech.com. And on there, you can sign up for a waiting list, just fill out our contact form. And we're looking at middle of next year. So we need to wrap up the study and, apply for our FDA clearance, but that's our time frame.
Is it going to be something that you're only going to have? Where are they manufacturing the device?
We're still deciding. We have quotes from US-based manufacturers that work on medical devices. So, but we have a few options there. but no, we will aim to make it available widely
Oh,
from the
okay. So it's
beginning.
not as though, I know some other devices, it was really hard to get to. So people really needed to be on a waiting list when they first come out. But you're saying,
The benefit of the waiting list is we'll notify you when it's forthcoming. And so,
great,
yeah.
great. No, that sounds great. And anyone who follows me or my newsletter, I'll certainly let you know as soon as I hear any information. And I'll also, when I get one, I'll wear it and let people, I'll
Terrific.
make a little video. So
Thank
this
you
has
so
been,
much.
oh no, really my goal, I'm such a believer in really providing people with tools, because there's so much that can be done. This is what I've seen through all the years working with people with osteoporosis, osteopenia, that so much can be prevented, and there's so much we can do. And really to look at a diagnosis as okay, you found out, and when you make all these changes, guess what? The rest of your life gets better as well. So it's more of an empowering, there's things we can all do, and that's to me, and this just seems to be something great that we can add as well. So very exciting.
Great. I look forward to being back in touch when we're getting ready to make this available.
Yes, absolutely. Well, thank you for taking the time, and thank you for educating us. And I think everyone, it's exciting because something new and something that, and I'm a big believer in the science. So something that you're testing clinically, and it's not just something, oh yeah, I'll try this, but something that you're testing and really putting it through the rigors. So that,
Absolutely.
but well, thank you. Is there anything else before we leave you just want to share with everybody?
No, get on our wait list, stay informed. We'll be continuing to publish information about the product and the science, and we want to also help educate about this important area. So look forward to being back in touch next year.
Well, thanks so much. And thanks for the
Margie.
cutting edge information. So now you heard it here. Anyway, thank you, Laura. It's really been a pleasure. And thank you for doing all this work, because you are, just like you said, your goal is to make a difference. Well, I think this is really going to make a difference. So
me too.
Thank you so much. Thank you. I hope you've enjoyed my interview with Laura and now have an understanding of a new technology, OsteoBoost, that's based on the research of low intensity vibration, and it's a vibration belt. So I think this is a tool that could have great potential and really have a positive impact on our bones. I'm really excited about continuing to look at the research and what goes on with this product. So to stay updated, there's two things you can do. Number one, you can get on the wait list for bone health technologies, and I have that information in the show notes, or you can also go on my mailing list if you're not already on. And to do that, you just go to margiebissinger.com, my website, and on the very first page, you'll be able to opt in to receive information how to improve your posture in 2 weeks. So if you sign up for that, you'll get great videos on posture exercises, as well as a really good Qigong showing you something that you can do throughout the day to really help your posture. But then you'll also be on my list, and you'll be updated when I try the belt, as well as anything that I discover that I can pass on to all of you. So thanks for tuning in, and I look forward to seeing you on the next episode.